Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Nandini from Apollo Cradle and Children's Hospital. She's going to talk about fibroid uterus. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hello, good afternoon, everybody. This is Dr. Nandini. I'm an obstetrician and gynecologist from Apollo Cradle, Kondapur. Okay, here we are to discuss about the topic called fibroid uterus. First, we should understand what fibroids are. Okay, the fibroids are the tumors which arise from the muscles of the uterus, and they are also known as leiomyomas or myomas. Usually, fibroids are diagnosed incidentally, like you go to any specialist for some other issues and they do an ultrasound for you, then you may be finding it. They can be very asymptomatic, and sometimes they present with severe symptoms. And when you know that it's a tumor, you feel you are very scared about it, thinking it could be a malignancy. Fibroids are mostly benign. Most of the cases will be benign. Very less percentage of fibroids will be converting to malignancy. Okay, any tumor in any abnormal growth in the body are called tumors. So it is a very common gynecological condition which is seen in many women in the reproductive age group. From the age of 18 to almost 45 to 50 years of age, we see fibroids. Okay, and there are many types of fibroids. The reason for fibroids, which like why they start growing, is unknown, but there are many other reasons which help us know. Like they are estrogen dependent. There are some theories telling us that it could be genetic, like your mother or grandmother had fibroids, so there is a chance for you to have a fibroid too. And it is very common in few races like Africans and Black Americans. And in any woman who has very high BMI, there's a chance of like it could be a risk factor for the fibroid. And early menarche, when you have early menarche, history of alcohol consumption, and if you're having a diet which is very rich in red meat and high in estrogen content, these are the reasons where fibroids can occur. The types of fibroids are intramural, subserosal, and submucous. Okay, and sometimes they arise from the broad ligament. Broad ligament is the one which is beside the uterus. But the fibroids are told to be intramural, subserosal, and submucosal depending upon the location in the uterus where they are growing. The one which grows from the uterine musculature outwards towards the abdominal cavity, it's called subserosal. The one which is growing into the uterine cavity is called submucous, and the one which is growing in the musculature itself is called intramural. Okay, and these fibroids vary in sizes and number. Many patients may have a single fibroid, and few patients like have fibroids which are multiple. Like they may be completely occupying the muscular wall of the uterine cavity. And the size can be from as small as a small seedling to a very big size which may grow up to the rib cage also. And these completely distort the uterine cavity. And the symptoms which usually the patients with fibroid present are, most of the cases will be asymptomatic. They may not have any symptom, and the symptoms usually presenting will be heavy bleeding during your periods, like flow is very prolonged, or there's a lot of pain in the lower abdomen, even in between your periods, and during your periods, the period cramps become severe, and there's backache, and few others not related to your cycle could be because of the size of the fibroids. Okay, the fibroid, if it's located just towards your urinary bladder, it may start pushing the urinary bladder, causing pleasure symptoms like you have more frequent urination, or urinary retention also when it's not occluding the outward outflow of your urine, and also sometimes constipation which is growing towards the rectum, and other pleasure symptoms. And sometimes there's no symptom, it's just that the heavy feeling in your abdomen also be present, like that it could be the reason why we diagnose you with like fibroids. And there are other symptoms in pregnancy. You're already pregnant with having a fibroid, you may have some uh, like symptoms like bleeding in early pregnancy and miscarriages happening or any preterm deliveries. And sometimes you may not be able to conceive because of the fibroid. How the fibroids are diagnosed? The main first, it could be an incidental finding when you have done ultrasound for some other cause, or when you come with the symptoms, we take a detailed history, how your periods are, what are the symptoms that you're presenting with, and then we do a thorough examination. On the abdomen, sometimes the uterus can be felt as a big term pregnancy size of the fibroids also. We see palpate the uterus on abdomen if we are able to palpate it. Usually we will not be able to palpate uterus, but if you are able to palpate the uterus, that shows that there is a growth in your uterus. Or we'll do an internal examination afterwards. The internal examination is a bimanual examination. There we understand the size of the uterus and where it is growing, or is there any other discharge or any excess bleeding or anything we'll be able to understand. And then we do confirm the findings what we are doing in an internal examination by an ultrasound. Ultrasound is the best method to diagnose fibroids, but in the ultrasound, after doing an ultrasound, if you're proceeding for any procedure, then we go for an MRI if required to exactly know the location and number and size of the fibroids. Ultrasound will give us the diagnosis mostly. How the fibroids are treated. Actually, fibroids are very common. They are present in reproductive age group of women from the age of like 18 to 40, 45 years or 45 years, and they're very but it's not all fibroids should be treated until unless they're causing you some symptom or they're causing you problems in conceiving. We should not be like we'll not be treating the fibroids. The fibroid size, location, and the symptoms what they are causing will help us how to treat the fibroids later. Not all fibroids require treatment. And age of the patient where the fibroids are diagnosed also will tell us whether the patient should be requiring any surgery or not. Okay. And most of the symptoms can be managed medically. Okay. But many people may ask us like, okay, I have a fibroid. Can I reduce the fibroid naturally without any medication? Usually fibroids cannot be dissolved on its own naturally. Whatever the medication we give can reduce the size of the fibroids a little bit, but they don't completely dissolve the fibroids. Okay, and the treatment will be depending upon your symptoms. If you have a lot, like heavy bleeding, and it's causing you a discomfort during your periods, according to your symptoms, we treat you. Like if you have pain, we give you NSAIDs during your cycles. And for the bleeding, the tranexamic acid is the one which helps us reduce the bleeding. There are other medications like GnRH agonists and GnRH antagonists, which help us reduce the bleeding and shrink the fibroid a little bit. And there's one more option called progestin releasing intrauterine device, which will help us control the heavy flow caused by the fibroids. But any medication what we are using or these IUCDs does not shrink the fibroid size completely. They help reduce the flow and reduce the heavy periods and relieve your symptoms a little bit. And if you have to if you're planning for a pregnancy, you have to go for surgery if the fibroid is inside the uterine cavity or it's causing obstructing any if it is the reason why we feel that it is going to be causing the problem in conceiving, then you'll have to go for the surgery. And the options for surgery would be myomectomy. The main treatment will be myomectomy, or sometimes we remove the complete uterus. If you're planning for pregnancy or you want to retain your reproductive function further, we remove only the fibroids. That is called myomectomy. It can be done laparoscopically and it can be done through open procedure also. Depending upon the size and location of your fibroids in the uterus, we do that. And when the fibroid is inside the uterine cavity, like it's protruding into the cavity, which are submucosal fibroids, we may have to do a hysteroscopic myomectomy also, wherein we put a small camera from your uterus, from the cervix into the uterine cavity and remove the submucosal fibroid. Okay. The most, sometimes the size doesn't tell you what symptoms you have. Fibroid can be a smaller size one, which might cause you a lot of symptoms, which usually in the submucosal region cause painful periods and heavy flow. But the subserosal fibroids, which are outside into the abdominal cavity, will not cause you symptoms until unless they grow to a very big size. Okay. And if the patient's age is more than, like, they've completed her family and she is not planning for any further pregnancies, and she's crossed the age of 45 years and she's having severe symptoms and they have multiple fibroids, we usually go for removing of the complete uterus completely. That is called hysterectomy. This procedure can also be done laparoscopically and also through open procedures. And there are some other condition other surgeries which treatments which we can give, where it is called conservative treatments. We are not completely removing the myoma, or we are not removing the uterus completely, but we reduce the blood supply to the fibroid which is growing by doing a uterine artery embolization. So when the blood supply is coming down, the size of the fibroid comes down, and also the bleeding during your periods will come down. And there is and one more procedure called MR guided HIFU. This is a high frequency ultrasound which will reduce the fibroid size so that the flow during your periods will come down. Okay, and there are few ways which you can help, like, naturally avoid the fibroid to grow further. Even you have fibroids, you're not having any symptoms, but you don't want the fibroids to grow further. There are few lifestyle changes which we can do, as it is an estrogen dependent tumor. Estrogen dominant diet should be reduced in your day to day. The estrogen dominant diet includes all this plastic packaging and what do we say? All these soya foods, food additives, which preservatives, what we use, and plastics. All these plastics contain xenoestrogens. These will leach into the food which you are packaging in those plastics, and that will cause increase in your estrogen levels in the body. So these will help. This will, if you are avoiding these, this will help reduce the growth in the fibroids. And always we should keep our BMI under check by having a healthy lifestyle and follow a plant-based diet and avoid any alcohol and smoking intake, and also have a diet which is very rich in iron, as you are losing a lot of blood in your periods, hemoglobin will be falling, so for that iron rich diet will help you. And supplements like B12 and iron, vitamin C, if your doctor prescribes, you have to follow these. But we cannot naturally shrink the fibroid completely, but we can alleviate the symptoms better following a healthy lifestyle and following the instructions given by your doctor. As you always do not panic whenever you have a fibroid, but follow the instructions which your doctor gives you and uh, go accordingly. Thank you.